Johnny from naturalhappiness.ca. I'm talking in this video about anxiety and some natural approaches to treating and helping anxiety. First, I want to talk a little bit about what it is. It's a word that gets used to describe a wide range of different experiences and gets used interchangeably with stress. And anxiety also gets talked about as something that's quite normal, that everybody has anxiety when faced with something stressful or some kind of threat, as well as anxiety being problematic at times for some people, and it can come in the form of anxiety disorders, and there's actual diagnostic criteria for a wide variety of anxiety disorders that gets used in medicine. But the way that I want to think about it, at least for the purposes of this video, is to talk a little bit about what it is and how it shows up in a more phenomenological perspective. And in other words, that means just what is the actual experience of having anxiety. And anxiety for many people shows up predominantly as something that's quite full-bodied, as well as something that shows up in our minds. The body component can be described as a kind of hyper-arousal state, where the symptoms of anxiety are often increased heart rate, a sense of energy or agitation that's felt physically through the whole body, tension in the body. It can show up as butterflies in the stomach or nausea. Headaches are quite common with anxiety. Decreased ability to make decisions or to focus. And then, of course, all of the mental phenomena or the mental experiences that come with it, which is all of the kinds of thinking that we engage in, the kind of catastrophic thinking, excessive worry about a wide variety of things, or excessive worry about something very specific or particular. And anxiety really falls on a spectrum of anxiety that shows up that's quite overwhelming and debilitating, that's too much or maybe abnormal, and then anxiety that's in a more normal range, that's quite functional for us. You know, if we didn't feel anxious, then we might not prepare for the exam we have in school or the work meeting that we need to present at. But too much anxiety can actually get in the way of being able to function properly and perform well at the same time. So there's a kind of sweet spot or a curve where, you know, the right amount of anxiety gives us the perfect amount of motivation and energy to face challenges in our lives, but too much anxiety is debilitating. And often what happens with anxiety when it gets more debilitating, where it starts to get in the way, is when the symptoms of anxiety are really overwhelming themselves. So the physical components and the mental components are experienced as being out of control, or that I can't manage anymore. I can't seem to manage this state and the things that I'm doing to sort of make it better, or maybe in the long run making it worse. And this shows up in a wide variety of contexts. So I'll talk about something specific. One anxiety disorder is described in medicine is called social anxiety disorder. It happens to be the most common anxiety disorder that we find in North America. And it's really simply just worrying about the judgment of other people. And this, of course, again, just like everything else in terms of anxiety, there's a normal amount of this kind of anxiety. We're social animals, and we have to have some amount of attention and a bit of worry about, okay, well, am I acting appropriately? Is what I'm saying being well received? Do other people in my life, in my communities, do they like me? Do I fit in or not? So some social anxiety is actually very functional and very normal, but it gets to become too much when the anxiety is getting in the way, and then the behavioral shift and change is to withdraw or to avoid social engagements, to limit one's life so that no longer, you know, maybe I'm no longer going to school, or I'm not going to work as often, or I'm calling in sick, or I'm not going out with my friends, or I'm not going out and meeting new people. Even though if anxiety weren't a problem, these are things that I would actually like to have in my life. And so here, you know, there's the external situation that causes the anxiety, which is like some kind of social interaction. But then part of what's really being avoided is how the situation makes us feel. I feel all of those horrible symptoms of anxiety in anticipation of that event. So rather than going to that social event, I'm going to avoid it, thus not having to feel the symptoms of anxiety. And this kind of avoidance of the physical and mental experiences of anxiety are actually a big part of how we want to treat anxiety. We want to start to develop a sense of confidence and capacity to tolerate and experience anxiety and still be able to do the things that we want to do in life. So from a psychotherapeutic approach, which might include something like cognitive behavioral therapy or a mindfulness approach, the idea is to actually turn towards the anxiety in small, graduated fashion and do more and more of the things in our life that we want to do, even though we might be scared to do them. And actually to do them because they make us scared, because they make us anxious, because that gives us the opportunity to sort of learn a different way of being with anxiety rather than running away from it or avoiding it. Of course, this is very, very hard to do. And this is why it's quite helpful to have a structured process or therapeutic relationship with somebody there, where within that relationship, within that context, this work can be done, because it's super hard to do. Anxiety can be really overwhelming and debilitating. The other thing that is important about this is that we really want to be able to approach situations in life that bring on some anxiety but not too much. So you want to start slow and work with it step by step. One of the things that can really help with that is actually doing things other than the therapy to help bring down the baseline level of anxiety, so that approaching the anxious situations, the anxiety-provoking areas of our life, become more tolerable, more possible. Some of the things I've found to be really helpful are, excuse me, just got messaged, are to engage in some acupuncture. What acupuncture has the ability to do is to really bring down that autonomic, sort of sympathetic nervous state, that hyperarousal that comes on when we're anxious, so that it can actually be quite relaxing and calming, and can bring the baseline level of anxiety down throughout the course of the treatment. I also find certain treatments like St. John's wort and withania, skullcap, valerian, and other anti-anxiety herbal treatments to be helpful as well, when combined in a way that has this long-term sustained lowering of anxiety, rather than having an acute sedating effect. In general, unless things are really horrible and they need to be kind of calmed down really quickly for a specific purpose, sedating treatment is not all that helpful, because what it does is it kind of really, you utilize the sedating treatment in response to a high anxiety moment, and what that ends up doing is that it can actually contribute to this sense that I can't actually cope with the anxiety myself. When my anxiety spikes, I take the treatment, then it gets better. These more long-term sustainable treatments, they're things that you take every day at a set time, and they just kind of, it's like bringing the fever down overall. So you're still getting the ups and downs of anxiety based on the situations you're facing, which is really important in terms of really starting to turn towards anxiety and treat it through a psychotherapeutic approach. But the spikes aren't quite as high, and so overall that approach becomes a little easier. I often will also refer out to a family doctor or psychiatrist for an antidepressant, anti-anxiety medication. The reason why I use both antidepressant and anti-anxiety is because really the drug of choice in most cases is an SSRI, which can be helpful for both. And an SSRI has this kind of long-term lowering of anxiety, which ultimately can be really helpful. And then it's about finding the right medication that's a good fit, because some of them have some side effects that hit people in different ways. And so those are some of the things that I think can really complement this kind of exposure, turning towards therapy approach for dealing with anxiety. And just in general, even if anxiety is not completely overwhelming your life, if you're noticing your anxiety is creeping up and things are feeling a little bit more difficult, one thing to do is to just take a step back and to spend some time writing down what are the areas of your life where you're feeling more anxious, where you're feeling a little bit more out of control, and what are the things that I've been avoiding? What have I been really not wanting to look at, whether it's something to do with relationships in my life, or work-related issues or finances or some conflicts in my friendships or any number of things, really kind of taking a step back, going, what am I avoiding? And then looking and taking that problem and breaking it down into small steps, slowly trying to approach the thing that's causing the anxiety. And that can be a really helpful way to start to tackle it. And generally what I find is that if you start to approach something that's causing anxiety in one part of life, it actually helps anxiety that might be showing up in other places in your life, such that they just start to become a little bit easier to manage. So those are some of my thoughts about anxiety in terms of naturopathic treatments and CBT. And the only other thing I would recommend and suggest for many people is that mindfulness and meditation can be really helpful, but not necessarily in the way that you might think. Many people think meditation is going to help because it can be really relaxing. And sometimes a meditation can be relaxing, and not to discount that effect, but what I find to be the most powerful component of meditation is what starts to come, what gets trained through the meditation. And when we're sitting and doing meditation, we're actually really focusing our mind in very particular ways and approaching the experience of ourselves with a kind of openness and interest and curiosity. And then we want to try to bring that training and that same open, curious approach to the symptoms of hyperarousal when we're anxious. And what that starts to do for us is we start to work and utilize the techniques of meditation when we're feeling anxious. And this can help give us a sense of comfort and ease with an otherwise quite distressing state. That maybe makes it feel a little bit less overwhelming, or a little bit more like we have the ability and the resources to cope with it, which deals with that kind of phenomena when anxiety gets really bad, which is we can start to get anxious about feeling anxious. And that's when there's a real perpetuation of the anxiety. So we do everything we can to avoid feeling anxious. And as soon as we feel a little bit of anxiety, we get anxious about being anxious. And then that whole thing takes off, and we can really spiral out into some pretty disturbing and distressing states. So if we aren't so afraid of the symptoms of anxiety, because we've learned some techniques and approaches through meditation to be with anxiety in a different way, it can really circumvent or cut through that really bad loop, that bad cycle that gets us stuck. So that's a little bit of an idea as to how meditation can be helpful. And again, if that sounds interesting to you or you want to reach out, there's a wide variety of resources. It's important to work with somebody who's got experience with meditation being applied to anxiety. So those are my thoughts. If you have any comments or questions, please post in the comment section below. And if you like the video, please follow the channel. We'll be producing more videos as time goes on. And otherwise, have a very happy day.